A new study out today is raising concerns about pregnant mothers taking antidepressants.
And specifically whether those drugs increase a woman's risk of having a child with autism. Now we know this is a highly emotional issue. And as Dr. Mallika Marshall explains, there are a number of factors to consider.
New data from researchers in Canada suggests the risk of autism nearly doubles for children whose mothers take antidepressants during pregnancy. The findings show the risk shot up 87% in preschool children whose mothers took drugs like Prozac or Zoloft in the second or third trimester. But doctors warn untreated depression poses its own risks for mother and baby, and that the autism risk remains very low overall, between 1% and 2%.
That means that the chances of these women not having a child with autism were about 97–98%.
Dr. Alan Manovitz is a psychiatrist who looked at the study.
People should not panic.
He says he will continue to prescribe antidepressants to pregnant women who need them.
Over the years, I've worked with many obstetricians, and we have to decide individually for each person what the risk-benefit ratio is.
Doctors emphasize the most important thing is to keep taking prescribed medications and consult your physician, not to stop them abruptly. And they say talk therapy and other non-drug options may be an alternative for certain patients. Okay, so this is another recent headline identifying a possible risk factor in mom that could increase the risk of autism in her child. Last week, it was polycystic ovary syndrome. But I want to remind parents that there are a host of conditions and exposures that are being investigated, and that with every study that's done looking for potential causes, moms and dads should not blame themselves. Lisa, Liam.
Doctor, thank you. Well, foggy.